Welcome to The Age Guide, the podcast where we give voice to older adults and caregivers, challenge ageism, and offer guidance to help you thrive on the journey ahead. I'm Gretchen Knowlton, your host. This season, we're diving into what it really means to age well, from keeping our bodies strong and our minds sharp to nourishing ourselves and building more inclusive and connected communities. Today, we're joined by Ryann Hill to talk about the forces shaping aging policy, the value of strong advocacy, and what it takes to support older adults nationwide. Ryann Hill is a nationally respected government affairs and public policy strategist with over a decade of federal experience advancing healthcare, aging, and disability policy to drive meaningful change for older adults and underserved communities. Ryann, I'm so excited to talk to you today. Thank you for being here.
Thank you so much for having me on. I've been a fan of the podcast. I've watched several episodes. And so when you reached out, I was like, absolutely, yes, I cannot wait.
Excellent. And I've heard you speak on a number of webinars as well, and just really excited to connect the work that we're doing here in Illinois with what you're doing there in DC. Can you start with a story about why you do the work that you do? Maybe who influenced you or what made you care so deeply about public policy that you would start your own business?
Yes, because it is just a wild time to be in where you're starting your own business in politics.
Sure is.
So I was, and my story actually starts in Chicago, where I'm born and raised. So I was deeply influenced by my late grandmother, Nancy Ferguson, on the west side of Chicago. She was this incredibly fiery, passionate, 4'11" giant who was really a household name that felt like on the west side of Chicago. She really loved her community and really believed strongly in holding politicians accountable. We constantly had aldermen and city council members calling the house to talk to her about some things that she was requesting in them. And we would watch C-SPAN growing up. And I just always thought that, this is how you engage in politics and policy, right? Like you have a front row seat. You're an active agent in shaping the forces that are shaping your community. And I didn't understand how powerful a lot of those moments were at the time. I just knew that politics really mattered in our house, and that I think even more importantly than that, civic engagement was really a responsibility of every single person in our community and not some sort of abstract idea. And so I actually wound up creating my own major in health policy at the school that I was at because I wanted to really understand how government decisions were shaping people's access to care and support across their lives. And that came from my experience on the west side of Chicago, right? When you think about health disparities, I learned that your health is most likely to be determined by your zip code than most of the time your individual health behaviors. And that's really why I do this work. I always come back to my grandmother. She showed me early that policy and politics are personal and that communities are the strongest when people are informed and engaged and willing to really speak up.
Excellent. That's so cool that your grandma had such an influence on you,
Yeah.
and she was right here in the Chicago area.
Yes,
Love it.
yes.
So, from your vantage point now, and with the 2026 midterms coming up, what are the biggest policy forces that you see shaping aging right now? And what do they mean for older adults and families? Can you give us a little clue?
Yeah, gosh. I mean, I feel like, first of all, Gretch, I could talk about this exact topic for what feels like hours because
This
this
is
is
it.
absolutely what I'm really passionate about. So why don't I take a second to zoom out and talk a little bit about the demographic shift that we're a part of that I know you and your listeners and the people that they work with every day know in real time. So, you know, right now we had 82 million Americans that are over 60. And for the next about 20 years or so, we'll have 10,000 people turning 65 every single day. Great numbers, very awesome to see people, living longer lives. We hope that those lives are full of integrity and healthiness and happiness. The issue is that the policy here in Washington, D.C., and I would also argue policy in certain state houses, has not yet caught up to that demographic shift, right?
Mm.
At the same time, we're seeing the systems that really support older adults and their families coming under real strain. Again, going back to the fact that those policies haven't caught up. We know that we have a large number and growing number of unpaid family caregivers. We have, with the number of formal caregivers shrinking, what feels like every day. We have, so many issues with the care workforce, care gaps, technology issues. We need more than 1 million additional direct care workers by the end of the decade, really just to keep pace with demand as to where we see it now. We have low wages, high turnover, workforce shortages, everything, all those things I just listed are making it really harder for older adults to really access care at their home and in their community. And so when we think about the biggest policy forces that are shaping aging right now, it's really what people are seeing every single day, right? You have limited access to care. You have, the issues related to coverage, Medicare, Medicaid, folks who are dually eligible. You have an aging population that really understands technology. I think in a way that a lot of folks, especially out in DC, aren't quite equipped to regulate
Mhm.
what some of these companies are doing. And so we have this, and on top of all of that, we also have funding issues, which I talk about the strain a little bit more. But we have a federal government right now that is focused on cutting a lot of programs and decreasing spend for a lot of programs that are so instrumental to making sure that older adults can live really the life that they want to. So everything is impacting aging policy right now. I think you have to think about the lens by which we apply aging to every single policy conversation, because that's something that needs to happen as well.
Mhm. Definitely. I think that was really a good reset just for us to kind of focus on the changing demographics and what that
Hmm.
means for today. And we have been really celebrating the 60th anniversary last year of the Older Americans
Yeah.
Act and thinking about what that means. And then it turned into that we were fighting to protect the Older Americans Act, which
Hmm.
almost got cut and the
Yep.
offices dismantled in DC. So that's been a lot of the advocacy work of our team here at Age Guide this last year. But
Hmm.
how about for listeners who maybe aren't familiar with what the Older Americans Act is, can you talk about that a little bit? Why is it so foundational to
Oh,
older adults
absolutely.
and families? Thank you.
So the Older Americans Act is one of my favorite bills. Maybe next to the Social Security Act and the Affordable Care Act. It is just such a monumental, life-changing piece of legislation, and we don't often see bills like this come through anymore. So the Older Americans Act is really the backbone of the aging services network in this country. Through Older Americans Act funded programs, we have more than, I think it's around 13 million older adults each year receiving services that help them remain healthy, independent, and really connected in their communities. It is really what we see as a giant funding mechanism. It is funding not only programs, but research and communications around what it is that older adults need in their communities, and how can the federal government use the financial resources really in their hands in order to make these programs accessible. So think things like Meals on Wheels, right? Think community
Mhm.
centers. Think, the things that, again, as I said earlier, what's impacting policy are in aging policy are the things that people are seeing every single day, right? The services that people really rely on every single day to live the healthy, independent lives are all connected to the Older Americans Act. Think transportation, caregiver support, social engagement, right? All of these things that are really important, not only for individual happiness, but on a broader scale. They taken together, they reduce hospitalizations. They can delay having to be institutionalized, and really overall, what we've seen as the data has borne out, that they've lowered healthcare costs. We know that 1 in 4 older adults lives alone, and more than 10 million are experiencing food insecurity each year. And this is with the Older Americans Act. I know that you talk about some of the advocacy that you guys are doing. There's been such a big push around the country to expand funding for the Older Americans Act, and so we're at this point now where we didn't even know if the funding, if the program, if the act will be funded. If I can tell a quick story of my time on the Hill talking about the Older Americans Act, I took a group of really awesome and fierce aging advocates to Capitol Hill for a Hill Day back in April. And one of the talking points that we were using was that we need to reauthorize and fully fund the Older Americans Act. And there was one staffer, I feel like this moment, I would never forget this moment. She was a Democrat staffer in a prominent Democrat Senate office, an office that is a huge champion of the Older Americans Act. And as we're talking about the Older Americans Act, she says, "Oh, yeah, I'm so happy that we got that passed last year." And we said, "Oh, no, no, no." Right. And I bring this up for a couple reasons, right? One, the first is that things happen so fast in DC that sometimes the staffers aren't even aware of what's going on, right? The Older Americans Act was in an end of the year package or a big piece of legislation from December of 2024. At the very last minute, it was taken out of that big package to get it across the finish line. So you have thousands of pages of legislative text, right? And this staffer, again, who works for a supporter of the Older Americans Act, didn't even know that it was taken out, right? So I say that one, that two, it's important to remember that this is why advocacy matters, right? This is why education matters and using your voice matters because you're informing people of things, not only based on your lived experience or your organization of people you serve, but just on the policy. And they just may not know that. And that moment for me, I'm like, yeah, this is why we're here. And our advocates jumped in and they were like, no, 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 this is what's going on. And that staffer has been incredibly responsive and really proactive ever since, right? But it's just a message that you have got to keep talking to people, even the people who you think are on your side. It's important to keep engaging in that conversation because what we've seen is that when the OAA funding is delayed or underfunded, the impact is immediate, right? Services are cut, wait lists grow, families are really forced to fill some of those gaps that we talked about earlier. And they're already stretched as it is. And so I think the Old Americans Act, the reason why it's one of my favorite pieces of legislation is that it's one of the most effective ways we've seen in supporting aging with dignity, while also being a bill that is fiscally responsible and bears benefits for decades.
Mhm. I agree with you. It's so powerful that the focus is really on home and community-based services in the Older
Hmm.
Americans Act. It does include protections for people who are in long-term care, and there's
Hmm.
funding for ombudsmen and for things
Yep.
like abuse and neglect. But the
Yep.
focus of the funding is really to help people stay where they want to be at home and in the
Hmm.
community. So I agree with you. It's such a
Hmm.
beautiful piece of legislation.
It really is.
Focus. As long as we've got you here and you're such an expert,
Yeah.
I think that the whole legislative process can be really confusing. And there's a difference
Hmm.
between the funding for a program and the authorization for the program. And I know that it's sometimes hard to understand the difference. So the Older Americans Act hasn't been reauthorized for a while, right? But it's still being funded. Can you unpackage that for us a little bit?
Yes. Question. I'm so happy that you're asking this. I'll start by saying that Congress and politics are confusing, right? It is incredibly complicated. I feel like I've been doing this for nearly 15 years and I'm still learning things every day, right? So I don't want anyone who's watching or listening to ever feel like it's not something that they can participate in or have an understanding of. So you're absolutely right. There's a difference between authorization and funding, right? A lot of times what we see is a program or a piece of legislation may be funded for about 10 or 15 or 20 or so, whatever the cadence is. That means that that money is basically I'm going to be very simplistic here, in a bank account, right? For the use of programs associated with that piece of legislation. Does that one bank account of this, right? But you get the imagery I'm dialing in here. The authorization is different. The authorization is basically what the governing piece of legislation that allows for the federal government to spend that money on the programs. And so while the Older Americans Act is funded, technically because the authorization is not there, it's questionable as to whether or not the government can or will continue on a consistent basis to draw down that money to fund these programs. And this is why the authorization piece is so important, right? Because you can't have one without the other. You don't want funding and no authorization because then it's very plausible that administration that may not be friendly to whatever the program is can take that money away with no recourse. You need the authorization because the authorization is the directive that says you're going to spend this money doing X, Y, and Z. And that's why we see these cycles come up of reauthorization and funding in the overall appropriation cycle and conversation because they're very, very important and they're very different. So you can see, like, wait, it's funded, so we're fine. No, 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 no. You still
Mhm.
need to make sure that there are basically instructions for how the government needs to use this money, or else it could go somewhere else.
Mhm. Okay, thank you for unpackaging
Hmm.
that for us. That's really
Yeah.
helpful. How do you approach these kinds of conversations with policymakers? You talked about taking folks onto the Hill to do some
Hmm.
advocacy work. Sometimes I think our policymakers see aging related services, like especially Medicare and long term care support, as
Hmm.
partisan issues.
Yeah.
Where do you see the strongest arguments or opportunities to make some arguments about common ground on these issues?
Well, I'll take this back to my grandmother, Nancy Ferguson. One of my favorite quotes from her, and I don't know if she originated this, but for the purposes of her being my superhero, she absolutely did. And it is, a broken clock is right twice in one day. And so, whatever clock you think is broken, right, there's an opportunity for them to be so close to where you want them to go that you can either nudge them there or that they're already there, right? And I think that 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 idea is lost a lot when we think about the sort of really toxic politics that we are seeing today. That I'll say it's very different than the politics that I grew up in, and I know a lot of people grew up in, and were sort of used to expecting this sort of camaraderie and respect that we just don't have right now. So my firm, Indigo Hill Strategies, we operate in a very bipartisan way. And I think aging is one of the best opportunities to be bipartisan because everyone is aging, right? And it's really about drilling down and making it so that we can have these conversations with folks across different across the political spectrum about shared realities and shared values, right? So aging affects every district, every congressional district, every state, every family, every political affiliation. Most policymakers, at least on the staff level, have an understanding of what it's like to care for a parent or a grandparent, right? Or to go pick up their medications for an older family member. Thinking about our own aging or hearing directly from constituents, if it is elected official, who are experiencing challenges related to the systems around aging has been so important in how to sort of bring people into the conversation, right? Like I say all the time, all politics are local. You have members of Congress who, whatever district they represent, those are the people who are giving them their jobs, right? And so it's really important to drill down as much as possible to highlight different, senior community centers, to highlight examples of aging and the systems around aging that are not working or could be working a little bit better, or areas of opportunity for that district, and make it so that as they walk around their supermarket when they're in their district, they can sort of connect the dots, right? I think there's really strong common ground between both parties right now of helping people remain independent, of supporting caregivers, and really avoiding more costly institutional care when it's not really necessary, right? We talk about Medicaid home and community-based services, which are now accounting for the vast majority of long-term services and support spending. Yet more than 700,000 people remain on waiting lists nationwide, right? And so for me, I look at that in my lobbyist advocate brain, and I say, okay, traditionally, and this is to really generalize here, but the Republican Party is a party that cares about lower healthcare costs, lower healthcare spending, right? And making sure that people can be independent. Democrats also care about independence, right? And expanding services so people can maintain, their integrity and all these things, right? That that Venn diagram, that middle circle is pretty big, right? And it's really about identifying where they sit within
Mhm.
that middle part of that Venn diagram. And we've had so many, I think, great conversations with Republicans that as they're sort of realizing that they're right there in that middle, it opens the door to talk about, the importance of connecting dots between aging services and workforce participation and healthcare costs and community stability. And the conversation is really able to shift, right? So you ground the discussion in local issues and issues affecting the caregivers in their areas, their constituents, and then you're able to zoom out and talk about this is the system issue, and this is why we need to sort of bring forward policy or have a congressional briefing, or have a roundtable in the district on this issue. And you would be so surprised as how members of Congress are able to work across the aisle there.
Excellence. Everything is local. It all goes back to everything
It's
being
all
local.
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 Everything is local.
Yes. Excellent. Those are some good tips for people who, maybe want to talk to their local legislators or go
Yeah.
visit the Hill, and do
Yes,
some
call them,
advocacy
talk
work.
to them. You pay for their salaries. You need to talk to them.
That's right. I hope that some of our listeners will take this and it'll inspire them to reach out to their legislators. And that's a great way to do it. Really bring it home to what's going on in district.
Hmm.
Tell a
Yeah.
story about what's going on in your own life, if you're a
Yeah.
caregiver or if you're aging yourself, just to share the challenges and some stories about what's going on, and then to tie it to, like you said,
Hmm.
the bigger systems
Yeah.
and the cost savings as well, the return on investment of those
Yeah.
programs.
Yeah, absolutely. And there's one more thing I'll say on that is that, we work with a lot of Republicans, given the fact that, Republicans have this trifecta of power right now. And there's a Republican congressman, I won't name him, but he said something to me that I feel like it just like sticks in my brain. He said, Ryan, we've been getting a lot of vinegar lately. We need some honey. And why not have it be your issue that's the honey?
Yes, that's a
Hmm.
bipartisan issue that
Yeah,
everyone can
bipartisan
come
issue.
together on. Yes, we do
Yeah.
need some of that. We do
You
need
need
that
some
right now.
honey.
Yes. So, speaking of some of that divisiveness, that is not the honey piece of it, unfortunately. I'm going to take us back there for a minute. But by the time people are listening to this, January 30th deadline may have passed for the funding bill, and who knows where we're going to be yet in terms of the government being refunded or perhaps a shutdown at the end of the month. What do
Mhm.
you think is the real likelihood of a shutdown? And maybe what can people kind of be preparing for?
I think that the thing with government shutdowns, and if I could just take the opportunity to zoom out just a little bit on the fact that the conversation around the government shutdown feels so evergreen right now, right? I feel like every single time over the past several years, but especially since inauguration in 2025, we've seen. We had a threat of a March shutdown last year. We had the longest shutdown in history in September, right? We're at the point now where we are just a few days out from the government funding deadline, and we could very well see ourselves in a shutdown unless someone pulls something at the 11th hour, which I wouldn't put it past them, right? The trend line here leads us to believe, and I'm a lover of history, and I do think I have great pattern recognition, that the trend line shows us that we will be in the same position of wondering whether or not we'll have another government shutdown come September, right? When our
Mhm.
next funding package is set to end. So I think regardless of what the sort of issue du jour that we find ourselves in September, right? We're going to be in the same situation, right? Of something happening, the parties not being able to get together, right? The White House maybe not being dialed in or too dialed in as we've seen in the past,
Mhm.
right? We're in perpetuity in this shutdown territory. And so I wanted to say that at the onset because the risk of disruption is so real, especially when the final outcome is uncertain, like where it is right now. Like I have
Mhm.
absolutely no clue what's going to happen. And I think what matters the most here is helping people understand the practical consequences of shutdown possibility without being alarmist, and also without sort of getting us into this mode of just being more downtrodden about the prospects
Yeah.
of a functioning government. And I think it's an interesting line to be able to walk. We know that government shutdowns or funding delays, they slow payments, they disrupt planning, they create staffing uncertainty, right, across different entities that older adults are relying on that we've talked about earlier today. And I think that's especially true for the community-based organizations that already operate on very thin margins in the aging in general, but especially in the aging spaces we just talked about, what we talked about with the Older Americans Act and their funding. I think what I would recommend that people think about here or start to do here is really to develop this culture of awareness around this perpetual state of possible shutdown, right? When it's time for, the government to start to renegotiate funding, prepare for what can happen to your organization, right? I would recommend people think about having a contingency plan, right? Having an operation contingency plan for what happened, starting to think about alternative funding sources for some of the things that can be funded alternatively. Think about, your own staffing plans, right? Like what needs to happen? Where do you go down? Like the federal government, I think does a really good job of having these government shutdown contingency plans on their websites for each agency, right? I think, and they're always prepared for a shutdown, no matter what. And I think that it's really important that we start to think of having that same sort of mentality. I know a lot of organizations do that as well, because whether or not we're thinking about what's happening in Washington, we also have to think about state budgets, right? Like states are also, operating on tight budgets. And some states, they are only in session every few years, right? And so it's an increasingly complex situation landscape for organizations, but it's really important to think about how your organization and the people that you all serve will be impacted, what the day to day is going to look like, right? And I will also say what complicates this even further is the fact that you have a full government shutdown and a partial government shutdown. So which is even open? We had a full government shutdown in September, the longest in history. This if there is a shutdown at the end of January, it will be a partial government shutdown, right? But the agencies that are, the most influential for the aging services world, Health and Human Services, for example, is going to shut down. It's on that list. And so I wish I had a better answer for you and the audience listening, but develop this culture of awareness, start to think about, how you can withstand a shutdown, what needs to happen in order to do so. Because unfortunately, I think that we're going to be in this perpetual state of will we or won't we up until the 11th hour, I think for the foreseeable future.
Hmm. Yeah, so it sounds like this is maybe the new normal, and we
Yeah.
do need to get used to living with some of that uncertainty. So
It's
that
very uncomfortable. Yeah. But
Mhm.
I think we have to, just have to.
It is what it is, right? So
Mhm,
that
mhm.
helps to kind of put some perspective around it. It's not just a one-time thing. So no matter when people are
Mhm.
listening to this, that's relevant. The fact that
Yeah.
government could shut down at any time. Yeah. So if you
Yeah.
could leave listeners with one piece of advice on what they can do today to strengthen the future of aging services, what would you recommend that they do?
I would have to say to start local and stay engaged, right? We talked about all politics being local. We talk about everything, that's shaping aging policy right now, really happening in the home, in the community, and bubbles up. I would recommend that folks learn who their area agency on agings are, right? What services are available in the community, understand who relies on those services and what the gaps are. And I imagine that, the folks who are engaged in this work already have an expert level understanding of the fundamentals, but share that information so that you have more people who have this expert level understanding of the fundamentals, and also share your story, right? The policymakers respond to informed voices that connect policy decisions to real outcomes, right? They can talk about what's happening on the ground and then connect to those systems that we talked about earlier. As I mentioned, you guys are paying the members of Congress and their staff salary, right? Like a call, an email, or a meeting is something that you really need to take advantage of. Be it, I'm a big fan of virtual congressional meetings, often because, as someone who worked on the Hill, has been on the Hill for a long time, I don't like to go to the Hill. So I try to stay away. Even though my DC office is just a few blocks from the Hill, I only go when I absolutely need to. But a staffer is much more inclined to take a virtual meeting than to try to squeeze you into a small room in the office and really take advantage of that, especially for folks who aren't in DC.
Mhm.
Advocacy can be wherever you are. We know that aging services are really shaped over time, and that protecting them requires consistent, informed advocacy from people who understand what's at stake. So really start local, stay engaged, and make sure to tell your story.
I love that. Thank you for sharing that. It sounds so
Mhm.
hopeful. There really are things that we
Yeah,
can
so
do.
there are great people in DC. They're great politicians and great policymakers. And as I mentioned earlier, they're looking for honey. They're
Mhm.
looking for opportunities in bipartisanship. I've talked to congressional staffers on prominent healthcare committees for healthcare, aging, and disability, and they say nothing this year is going to move unless it's bipartisan. Right.
Mhm.
And so if we go back to the Venn diagram analogy, you need to let people know that they're right in the middle on aging
Mhm.
services issues.
Yeah,
I'm
this is an
hopeful.
opportunity. This
Yeah,
is a
I'm
wonderful
hopeful.
opportunity, and we can impact that by having these conversations. So
Absolutely.
everybody get out there and contact your
Yes.
legislators, set up that virtual meeting. It's
Set up
easy
the
to do that.
meeting.
It only needs to take
Yes.
10 minutes. Thank you, Ryan. That's really good advice. We've got our marching orders. We've heard from Miss Ferguson, your grandma. Has
Yes,
given us
yes.
some inspiration today. You've given us some inspiration today. Thank you so much.
Thank you so much for having me.
Hello, and welcome to your Medicare Minute. My name is Elaine Kaderis, and I'm the Health Promotions and Education Specialist here at Age Guide. Let's talk about Medicare benefits for falls prevention. Falls are not a normal part of aging and in many cases are preventable. Start with your initial or annual wellness visit, a Medicare benefit. When scheduling this appointment, specifically ask for a falls risk assessment. Your primary care provider will check your gait, balance, and strength. Additionally, a medication review should also be conducted as medications, types, and timing can also contribute to an increase in falls risk. Age Guide offers many programs related to falls prevention, including education and exercise programs to help you follow your falls prevention plan. Visit ageguide.org to learn more about these programs or call Age Guide at 1-800-528-2000.
Thank you for joining us on The Age Guide, where we explore the insights, experiences, and practical strategies that help us thrive as we age. To learn more about how Age Guide Northeastern Illinois is advocating for older adults and caregivers, visit us at ageguide.org or call our offices at 630 293 5990. And if you enjoyed this episode, please share to help others find us. Join us next month as we continue exploring what it means to age well.